疫情防控而来。
Today we gather
新
here
型冠状病毒
to
感染的肺
review
炎疫
on
情
the
发生以
novel
来，
coronavirus
习近平总书记
pneumonia.
非常关心
After
疫
the
情的发
outbreak,
展和患者
General
的
Secretary
救
Xi
治情况，
Jinping have been
多次
following
作出重
closely
要指
the
示
changes
和
of
批示。
the
在
epidemic
大年初
and
一
made
组
multiple
织召开
instructions and
中央政
remarks.
治
On the
局
first day of the Lunar New Year,
党中
he
央成
chaired
立应对疫
the
情工作
Standing
领导小
Committee
组，部
meeting
署全
to
面加强
organize the
李
National
克强
Special
总理
Leading
多次
Group.
主持召开
And
国
Premier
务
Li
院
Keqiang also on multiple occasions
研究部
held
署
standing
疫情防
committee
控工作。
meetings to
孙
discuss
春
the
兰副总
prevention
理
and control
多
of
次
the
研究
epidemic. Vice Premier
疫
Sun
情防控，
Chunlan
并到
also
武汉一
gave
线调
important
研部署。
instructions and
昨天的
traveled to
国新
Wuhan.
办发布会上，
And in
马晓伟主任、
yesterday's
李斌副
press
主任以
conference
及
of
工信、交通运输
SCIO,
部门
Ma-
负责同志
Mao
介
Zhu
绍了
and
当
Li
前的
Bing
疫情情
have
况
given
以及
instruction
联防
of
联
the
控机制，
current
落实
situation
各项措
of
施
the
有关
pneumonia
情况。
and the
为
implementation
帮助
of
大家更好
relevant
地了解疫情防
policies.
控进展，
In
我
order
们
for you
将
to
加
better
大新闻
understand
发布频
the
次。
update
疫情
of
发生以来，国
this
委委领导
epidemic,
于1
we
月
will
22
increase the
日、1月
frequency
26日
and
两
we
次出
held
席国新办新闻发布会。1月21
conference
日，我
on
们
the
组织召开了
21st,
疫情
22nd
防
and
控的
26th.
国家卫生
And
健
on the
康委
21st,
高级别专
the
家组
National
集
Health
体采访。
Commission held
我们通过发
a
布新闻通稿、组织媒
interview
体
of
访
a
谈、深入
high-level
一线报道，
panel
进行了多种形式的新
presser
闻发布。在
and
伪官方
the
网站
news
和健康
release
中国
of
官方新媒体平
National
台
Health
开设
Commission
疫情防
has
控
been
专题，
carried out in a
信息的
timely
集纳发布。
manner
1月11日
and
起
has
进行全
been
国疫
and
情
these
每日发
information
布，
are
每天
released
早上
on
8点，
multiple
我们会在官
platforms
方网站
and
上，
on a
还有
daily
我们的健
basis
康中国
on
新媒
our
体
official
平台上
website and on
进
the
行
new
疫
media
情的动态发
platforms
布，为进一步加强信息发布，方便大
in
家
order to
了
further
解情况，
strengthen
在近
information
期
release
计划召
in
开日
recent
行新闻
years,
发布会，
we will be
通报疫情情
holding
况和
press
防控工
conference on
作，
a
围
daily
绕主题
basis to
介绍当
brief
前
you
的
on the
重点工
updates
作，
of the
普及
epidemic
相关防控知识，
and
并且和
and
大家进行交流。今天我们请来的嘉宾
carry out
是国家
public
卫生健康委员
education.
会
Today
疾病
we
预防
have
局1级巡视员贺清华，以及
Mr. 贺清华
中国疾病预防控制中心传染病所
of the National Health
冯路章
Commission
研究员。
and Mr. Feng
冯
Luzhao
研究
from
员也
CDC
将结合今天的发布呢，
who will
逐
be
一回应大
covering
家的问题。我们今天的主题是
the
要
important
介绍
issues and take your
新
questions. So
型冠状
today,
病毒
mainly,
感
we
染的
will
肺炎
tell
疫
you
情
more
社区防
about
控工作的
the
情况。
community
下面
prevention
呢，我先通
control
报疫情情况和
work.
防控工作进
First
展。
of all, a brief
大家
of
的手里
the
呢有这个
current
二维码，进入二维码就可以
situation
看
of
到
the
我们的
pneumonia.
文字
You
材
can
料。
also scan your QR
截
code.
至1月26日24时，新型
By
冠状病毒感染的肺
24
炎疫
of
情最新情况。1月
January the
26日0时
26th,
至24时，30个省区市报告新增确诊病例769例，新增重症病例137例，新增死亡病例24例，均来自湖北省。新增
and
治愈出
the
院病例
newly
2
reported
例，
confirmed
新增
cases
疑似病例3869。
769 and
截至26
133
日
suspected
24时，国
cases
家
and
卫生健康
24
委
deaths
收到
are
30
from
个省区市报告
Hubei
累计确诊
province
病例
and
2744例，现有重症病例461例，累计死亡病例
altogether the
80
confirmed
例，
cases
累计治愈
is
出院51例，现有疑似病例
22,744
5774
and
例，累计
80
追踪到
deaths
密切接触者
and
32794
the suspected
当日
cases
自
is
主医学观察
5,000
583人， 有
it's the
30453人
people
正
with
在接
close
受医学观
contact
察。
is
累计收到港
5,794
澳台地区通报确诊病例
and
情况。
in Hong
香港
Kong,
特别行
Taiwan
政区
and
8例，澳
Macau,
门特别行
8
政区
cases were
5
found
例，
in
台湾
HK,
地区
5 were
4
found
例。
in Macau, and 4 found in Taiwan, Taiwan
第二
region.
个情况，
And
通报一下
second,
疫情防控工作动态。连日来，国家卫生健康委会
the
同
National
联防
Health
联控工作
Commission
机制
work
各成员
with
单位，
all
认真贯
relevant
彻习近平总
departments
书记重要指示批
to
示和党中央、国务院决策部署，全面
carry
落实
through the
各项防控
instructions
措
of
施。
General
1
Secretary
月
Xi
26 日，
Jinping
国
and the
家卫
Central
生
Party
健康委印发
Committee.
通知，
In
加强
the
基层医疗卫生机构疫
26th,
情
the
防控
National
工作，
Health
要求严
Commission
格执行工作规范，
have
加强防控知识培
held
训，积极做好
conference
社区防控，
to
科学开展健康教育，
strengthen
做
the
好院内感
importance
染
of
防控等工
community
作。
of
组织河
community
南、吉
prevention
林、辽
and
宁、山
control.
西、陕西、天津、重庆 等
We
7
have
省市医
held
疗队共959人
We have
赴
organized
武汉实施
medical
医疗救治
teams
继续筹备
to
后
go
续
to
医疗队
Wuhan
紧急
to
调
in
配医用
assistance
外科口
of
罩
the
口罩
of the
防
work
护
at
眼
the
镜
front line
防护面屏医用防护服隔离衣等个人防护用
and
品
multiple
并建
medical
议物资
resources including
保障
surgical
医疗人员
mask,
个人防护
N95 mask,
修
glasses
订印发第4
and
版新型冠
protection
状病毒
suits
感染的
were
肺炎
organized
诊
and
疗方
sent
案
to
印
Wuhan
发新型
and
冠状病
we
毒感染
have
的肺炎
issued
防控
treatment
中
plan
常见
for
医用防护用品
medical
使用规范
uncov
使用范围
pneumonia
指引
and guideline
开发
on
疫情应对
utilization
处
of
置
medical
及物资网
protection
上申
for
报系统
prevention
及时了解
control of
地方
uncov
疫情防控
pneumonia
紧
and
急
we
物
have
资需
also
求
carried
派出
out
7个督导组
timely
赴北京、河北、上海、河
we
南、
have
湖南、
set
广
up
东、四
the
川等
filing
省市开展
system
督导，重
and
点督导
send
联防联控
7
机制运行情
supervision
况、值班值
teams
守
to
情
go to
况、
Beijing, 河北、
疫情
上海、河南、
监
湖南、
测落
广东 and
实情况、医疗
Sichuan
救治
to
工作
carry
情
out
况、
the
街道
supervision
乡镇社区村防控
and
情况、基层医疗卫生机构疫情防控情况。
to supervise
同时，
the
国务院联防联控
prevention
工
and
作机制
treatment
各成员单位
at
全
the
力投入
grassroots
疫
level.
情防控
The State Council
大家可以
also
到各
organized
单
all
位的网站去了
departments
解相关工作的
to
进展。
pull all
同时，我们也
efforts
会适时邀
into
请
the
联
prevention
防联控
control
工
of the
作机制的
epidemic.
有关成员
We
单位
will also
走上
be
我们这个平台，
inviting
向大家通报我们
the
的进展。
leaders of the relevant departments that joins the prevention and
情
control
况到此，下面
efforts
我们请
to our press
我们的
conference in
贺
future.
金华
That's
先
all
生
I have to
来
say
向大家
today,
介
and
绍
now let's give the
来
floor
向大家介绍社
to
区防控
Mr.
的
He
有关
Qinghua to
有
talk
关键
about
知识。
community prevention, control, and relevant documents
各位
and
媒体
policies. Dear
大
friends
家
from the
上午
press, good
新
morning.
型冠状病毒感染的
Since the
肺炎疫情发
breakout
生以来
of uncov pneumonia,
国务
the
院
Central
高
Party
度
Committee has
对防控
attached
工
great
作
importance
做
to
出了
it
一系列的
and
重要
made
部署
important instructions and deployment. On the 25th, General Secretary Xi Jinping chaired the standing committee meeting at the central level,
要
in
加
which
强
he
对流动人
instructed
员的疫
that
情
we
监测
need to strengthen the monitoring of the migrant population
对疑
to
似病例和密
quarantine
切接触
the
要按医学要求
suspected
进行
cases
隔离
and people with close contact
1月26
after we have confirmed the
中
cases.
央应对
On
新
the
型冠状病毒
26th,
感染肺炎疫情工作领导小组主体
the special leading group
李
leader
克强主持
and
召开领导
Premier
小组
of the State Council, Li
会议
Keqiang,
强调
held a meeting
农
in
村
which
医
he
疗卫生条
strengthened
件薄弱
that in rural areas, the medical the healthcare
要
conditions
高度
are
重视
relatively
农村
weak,
疫情防控
and at
充分发
this
挥基层
after
组
the
织
spring
和村医
travel,
的作用
the rural area also need to strengthen this kind of collective prevention and control of the epidemic. Since the outbreak of the epidemic, the State
联控
Council
机制各成员单位
have
迅速行动协调联动
urged all departments to act quickly and in a timely manner and to implement all of these relevant guidelines. Yesterday, Mr. Ma Xiaowei and Li
为
Bing
大家介绍了
of
防控
the
工作的有关情况
SCIO have a brief view on the prevention control
要
measures of
全面
the
动员
epidemic.
全面部署
One of it
全面加
is to
强
mobilize all
社区
resources in order
根
to
据应对
strengthen
新型冠
community
状病毒
prevention
感
and
染的
control.
肺炎
In order
联
to
防联
deal
控工作机
with
制印发
uncov
的
pneumonia,
新型冠状病毒感染的肺炎
documents were issued
社区防控工作方案
to strengthen community
那
prevention
么我想
control.
大家简单的把这个方案情况呢给大家做一些介绍。
And here is a brief introduction of this
社
plan.
区是实施网格化管理
The
的，
community level is the grassroots level and is the first defense line to fight against this
做到
pneumonia.
早发现，
So prevention and control at the grassroots level and early detection, early
将
diagnosis,
有
early
效地遏
treatment
制疫情的
will
扩散
be effective and make great contribution to the prevention control of the pneumonia as a whole. Right now we are at a very critical juncture in fighting the pneumonia, and the community level and grassroots level and rural area prevention
网格化的管理，
is of
将防控措施
crucial
落
importance.
实到户到人。
The
群防
responsibilities need to be more specifically
才能有效
designated,
实现
and this kind of joint prevention
防范。
and control of population flow is of paramount importance.
目标的总体形势。疫情防控，那具体的说呢，就是4
To be more specific, there are 4 aspects.
进行外来人员管控
First, to control and manage and track the migrant
这是当
population.
前社区防控工作的重中之重，也是
This is
防
a
止
paramount
蔓延的
importance
手段。
and
要
also
以社区
key
为保
to
加强
control
人员
the
健康监测
spread
多
of
海
this
人员
epidemic.
往来的情况，有针对性
We
的
need
采
to
取
know more about the migrant
重点追
populations
踪
and take
来自
targeted
疫情
measures,
发生地区
and
探索
especially the population who
进行
travel
居家
from
观察
the
实施
epicenter of the
监测其
epidemic.
健康
They
状
need to
况
stay
发
home
现异常情况
for
及时
at
报
least
告并采
14
取
days
相
and
应的
report their health conditions
防
in a
止疫
timely
情
manner,
输入
and
要建立
relevant
健全
measures and
疫
policies
情
must
防
be
控工作机
taken
制和
to
网络
strengthen the
工作体系
mechanism and the
建设
system
专
of
专监局的队
control
伍
and
充
prevention.
分发
We
挥
need to
监
also
察
organize
乡镇和社区
working
村
teams
干部基层医疗卫
and
生机构
the
业务人员
village
加
local
强医
cadres,
生团队的合力
as
借
well
大数
as
据手段
the
对
medical
会
workers
提
need
高
to
追
put a
踪
synergy
敏感
together
这
to
个性
strengthen
和
the
精细
tracking
化的
and
确保
treatment
追踪
of
到人登记
the
驾车
relevant
社区管理
cases.
上门观察一旦发现疫情立刻
Once
转
a case,
送
confirmed
有
case
关
is
医疗
found,
机构进行
this person must be sent to relevant facilities to receive treatment.
随
And
着越
second,
来越多的确诊病例和疑似病例
more
的
and
发
more
现
confirmed and suspected cases were found, so people of close contact, the number of people of close contact is increasing. So the management of this group of population also need to be strengthened. Communities need to work closely together
同时
to
积极指导社区做好新型冠状病毒感染的
guide
病
the
情的发现
communities
防控和
to
预警
strengthen relevant work in order to effectively implement the policies and the screening of these
要
people
发
of
动
close
社区的
contact.
网格员、家庭签约医生、预防保健医
The
生、
family
对密切接触
doctors
者
and
规范管理
nurses,
落实
community
密切
doctors
接触者居家医学观察措施，
also
每日
need to
随访密切接触
do
者
their
健康状
job
况，一旦发现情
and
况，
pay
及时
home
启动
visit
排查
to
诊
the
断
people
隔离治疗等
who
程序
with close contact who are staying at home for medical observation, and if necessary, carry out this quarantine and isolation methods. And also, we need to improve the hygiene of the community, especially and the environment at the community level, and crack down the illegal dealing of wild animals. And this has to be done at grassroots level, at communities, at villages, and even the every dustbins at the residential areas to reduce the bacteria as well as insects pests at this area. Hygiene measures also need to be taken, and sterilization need to be carried out at a frequent manner. And fourth, every family and every person has responsibility to understand the scientific prevention control measures to deal with this epidemic. And a lot of provinces and regions are promoting community prevention control. Take Beijing, for example, multiple measures were taken for screening, for monitoring, and control. And in Anhui province, there are also specific measures to register the returnees, especially from the epicenter of the epidemic. All of these policies have been strictly implemented and exercised. At community level, we need to stick to three principles. First is based on local condition. Second is collective efforts. And the third is specific and left no corners behind. So the general public can have a clearer understanding of the community prevention control plan. We will organize experts to compile these guidelines that include 6 aspects, namely
通用预防指南。
the general control measures of nCoV pneumonia. Second is people who have a travel history to the epicenter. Third is family with and confirmed cases. And fourth is control measure of public places. And fourth is guidelines on the public transportation vehicles. And fourth is guidelines for people with close contact. Beside these guidelines, we also have compiled this general introduction of nCoV pneumonia. This is very easy, very direct, and easy to understand. Even if you don't fully understand word, it has pictures to it, so that it will be much easier for us to push forward this work at community level, because it's very clear, very direct. This knowledge seems to be very technical, but we have simplified them so that our common public, our general public, can have a better understanding of this knowledge. That is the only way for us to really do this at the ground level, and it is only through this can we turn this trend around. That is all I have to say today. These guidelines are easy to be found online, and everybody has access to it, and I will not dwell on the details of it. And now the floor is open to questions especially on community level prevention control. Thank you for your introduction. Now the floor is open to questions, please. I want to say to our journalists and experts, our experts have been working 24/7. They usually work overnight. Right now, we have found confirmed cases in 30 provinces and autonomous regions and cities. So it's a rare opportunity for them to take time out of their busy schedule to meet with the press. So please identify yourself and use your opportunity wisely. And we will answer these questions as specific as we can. If we do not have the answer yet, we will record these questions and answer them later or online. I want to reinforce that these two experts are here and taking time off their busy schedule. So please focus your question around the topic of community prevention control. You can raise your question. You can raise your hands if you have a question. Please identify yourself before asking.
谢谢主持人，我是新京报的记者。我的问
Thank
题
you.
是，就是目前我
With
们也了解到
Beijing
有
news,
没有要求宣传。
the rural areas are lagging behind in terms of the publicity and education of the nCoV pneumonia. And an expert announced yesterday that there might be a turning point before the Lantern Festival. So can you tell us more about that? Our monitor said that we have given up our holidays and other work, but I believe that one important aspect in this effort is just and fair and truthful report of our media. This is part of my obligation. So I'm willing to do this. I really hope that our journalists can send clear and accurate messages to the public, to every corner of the world, so that people can understand the prevention and control measures of this epidemic. You asked a question about rural control and prevention. During the Spring Festival and before the Spring Festival, multiple migrant workers travel back to their home from cities, and they might be visiting their relatives during this festival. Plus, the rural population have little experience in terms of fighting SARS, because SARS mainly occurred in urban areas, so they do not have as high awareness as the city dwellers. Therefore, it has become a weak link in our efforts. In order to do the work well and make up for the gap, first and foremost, we need to utilize and take full advantage of the party organizations at a grass level in order to mobilize the public effort to do public education so that everybody can fully understand what this meant. But in order to take these measures, the party committees at the grassroots level have to take the lead. So I just want to to put it simple as that. The party committees at the grassroots level have to play the leading role in terms of education and publication of the general knowledge. Of course, we have some weak links in some localities. This afternoon, we will also be holding another teleconference on discussing the local control and prevention methods. If there is malpractice, if there is deficiency in their work, we will urge them to change and to implement these solid methods. With Renmin Daily, you also mentioned that there is a requirement that people with different health conditions need to seek medical help at different levels, and a lot of these community level hospitals are understaffed. How to address that problem? The National Health Commissions have made arrangement pointing out that the local governments need to mobilize grassroots powers and resources and ask the designated medical facilities to help health services at the community level. So you need to know more about your community, and the designated medical facilities must be carrying out this assistance to the medical facilities at the community level in order to address the understaffed problem.
谢谢主持人。中央广播电视总台央视新
with
闻的记者。
CMG and
那么我们这
CCTV.
些天呢，也是一直密切的关注的疫情，
We've been
也做
following
了很多报道。
closely
那么请问呢，
on
就
the
是
updates of
刚才
this
也提到说，这个为何要加强基础
infectious disease.
对新型冠状病毒的
You mentioned that we need to strengthen prevention control at grassroots level. Can you elaborate on the reasons for that?
喂，怎么回事？有了吗？好，我不用动哈。这个刚才这位记者问到的，为什么还要发一份基层的这个防控？
So why do we need to strengthen the grassroots level prevention control? It's the same as community level prevention control. It is a requirement for the grassroots level administration as well as medical facilities. So it's just a different way of saying strengthening the community level. This is for the purpose of leaving no one behind and leave no community or corners behind. And it's crucial to cut the pathway of the spreading of the disease. To be more specific, we have 6 guidelines and instructions for you to do that. So it's all about the implementation of the macro of the policies and methods at the macro level. So the Spring Festival holiday has been extended for 3 more days. So how do the general public arrange these extended holidays, and what should we do at home?
谢谢您的问题。我们新型冠状病毒感染，它是一个呼吸道的疾病。
This is a respiratory disease. So it's a it is spread through respiratory and droplet that is contributed by close contact. That's why we have extended the Spring Festival holiday. Staying at home is the best for the health, and it's also useful to control. So you need to avoid going to public places in order to reduce the risk of catching this disease and being affected by the virus. At grassroots, a lot of the officers will be going back to work and going back to offices, but the other general public, we suggest you to stay at home, reduce any travels as possible, reduce any chances of exposure to viruses. With CMG and CCTV, my question goes to Mr. Feng. So for the general public, we understand that 30 provinces and regions and cities have kickstarted level 1 emergency response. So how do people with a travel history to Wuhan and epicenter work with the community level offices to strengthen the prevention control measures? I think all residents need to work with the community level cadres and office and workers. If you have been traveled to Wuhan, and if you once were a Wuhan resident in 14 days, please do register at your community level administration. And in these 14 days, you also need to do self-monitoring and check your body temperature twice a day, and if possible, we suggest that you live alone in a well-ventilated home. If suspected syndrome were found, namely coughing, fever, difficulty in breathing, and sore muscle, plus that you have been traveled to the epicenter, please seek medical help at the designated medical facilities and state honestly to our medical workers your travel history. On your way to the hospital, make sure to wear masks, medical mask or N95 mask, and avoid taking public transport. Open the vehicle windows and keep your distance with others. And please notify the driver to sterilize the vehicle after you leave. We have several friends from the press, so maybe we'll give them an opportunity. Several foreign journalists, let's give them an opportunity to ask questions. And with Reuters, do the National Commission recommend to use AIDS-related drugs to treat the disease? And can you state the reasons for that? I'm not an medical expert, but we have made some. Our commission have made some arrangement accordingly. I think the food administrative officers would be in a better place to answer these questions, because I'm no expert in this, and so I don't want to be irresponsible. In the future, we will be inviting experts from other departments to take your questions in these aspects. Any other questions? And Spring Festival is extended till February the 2nd. Does that mean that the government can predict that this situation will be get under control within a week? If not, will the holiday be further extended? Extension of the holiday has been made public online. This is a judgment and careful decision after extensive discussion of the experts and officials. This is to extend this homestay period for the migrant workers and populations so as to cut the channel of disease spreading. And also it gives the relevant department some time to consider new measures as for prevention control. The extension of the holiday will allow our population to spend more time at their community and at home, which is crucial to the prevention and control. of the epidemic, and we will make further decisions as we based on the change and updates of this influence of this infectious disease. Last
中
question.
间靠走道这位。
谢谢主持人。南方都市报记者提问。
Thank you.
提到就是马上要开始这个社区防控的工作要求了，然后基层工作
The community level prevention control work will be further strengthened. So, what suggestion do you have to the workers at the community level?
提问。
Thank you for the
刚
question.
才贺局已经介绍了社区
Mr. He also mentioned a specific plan for community control and prevention. And the cadres, the family doctors, and community doctors and volunteers all need to participate in this. And some of these workers are working full-time, some part-time. So this kind of we call grid management at the community level will be very specific as to every building, every unit, and even every home, including information disclosure, information knowledge education, and materials management, and the sterilization of a living environment. Also, the community workers need to pay attention to their own health conditions. If they have found cases, suspected cases, and you have to report in a timely manner, and during your work, you also need to wear protection, wear masks, and check your body temperature twice a day. And at the community level in your offices, you have to have thermometers and sterilizers, and urge the families and the residents to do ventilation on a daily basis and avoid fatigue and take good rest in order to protect your own health. Due to time constraint, we have to call it a day. The fact that all of you are here shows your interest and concern of the updates of the epidemic. So we were deeply touched by your devotion to your own work. And I'm sorry, I apologize for some of the technical issues at today's presser, and we will do some checkups later so that next time our press conference can carry on in a more smooth manner. All of the content of today's presser and the materials will be made public on our official website of National Health Commission. And all of these guidelines, instructions will also be submitted to the National Health Commissions and will be made public on our website and our new media matrix. We have a lot of portals that can give you access to all of these materials. If you do not have an opportunity to ask questions today, our staff member will be in charge to record your question, to write them down, and we will give a reply to these questions as soon as we can. That's all for today's presser. Tomorrow at the same time, we will be holding our daily conference at the same location, themed the frontline medical work, especially the medical teams that were sent to Wuhan in assistance of this effort, which I believe will be a topic that you will be very much interested in. So welcome to tomorrow's conference, if you like. Stay healthy.